beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today's video is to celebrate Heart Valve Disease Awareness Day, which was yesterday. And in this video, I'm going to be sharing with you four very important pieces of information. And those include, first of all, what is heart valve disease? Second, what are the risk factors? Third, what symptoms would you have if you have heart valve disease? And four, can you prevent it? So before we even talk about what is heart valve disease, I just want to start off by saying there are four chambers of the heart, and in between the parts of the heart, you have valves, which operate kind of like doors. Like if you have a two-way door that opens this way, closes this way, the valves basically keep the blood within whatever chamber it's in until the heart pumps, the valve opens, releases the blood to go forward, and then it closes back. So that's kind of how you can think of the heart valves. Heart valve disease is when there is damage to the valve, and that causes an issue with either opening of the valve or closing of the valve. So with issues in opening the valve, that is called stenosis, and sometimes people refer to this as a stiff valve, and it basically limits the amount of blood that can flow through because the valve is literally stenotic and it's not allowing that much blood to go through or forward when the heart pumps. When there's an issue with the valve closing, then you have something that people refer to as a leaky valve, because when the valve closes, it doesn't shut, it's kind of like not really coming together, and blood is basically able to leak back into the previous chamber or wherever it was coming from. And again, it's messing with the flow of the blood, basically. And when you have these kind of things, heart valve disease, you have certain risk factors. It's a bunch of them, so I'm going to be referring to a list, but one of them includes older age, and that's simply from getting wear and tear on the valve for working over a number of years, or if you have calcifications on the valve that makes the valve hard, and therefore it makes it more difficult to do its job. Other risk factors: congenital abnormalities. Congenital meaning that you were born with it, whether you have a narrow valve or your valve didn't form properly, and therefore it cannot adequately do the job of opening and closing to the best of its ability. Another thing that can cause valve disease includes the category of infection. There's something called bacterial endocarditis, where you get vegetations on the valve, and that's from infections like staph or strep, and those vegetations, again, they don't allow the valve to operate the way that they're supposed to. You also have something called rheumatic fever, which is rare in the US, but it develops when a person has untreated strep throat, and eventually this leads to, again, valve disease. The next category I want to talk about, obviously, heart disease. We talk about heart valves, so obviously heart disease affects your valves. Number one, and I'm not doing this in any particular order, but heart attacks. When someone has a heart attack, especially if it involves a substantial amount of the heart muscle, that part of the heart can scar and therefore distort that portion of the heart and put some strain on the valves near that area. Another thing is if you have an enlarged heart or some type of cardiomyopathy like that, your heart is large or getting larger, and in the process is stretching those valves, again allowing it or not allowing it to function properly because now the valve is stretched. The other thing, long-standing high blood pressure. And I know y'all sick of me talking about high blood pressure in all of my videos, but it's literally a gateway to multiple conditions, because long-standing high blood pressure untreated contributes to heart disease, which puts stress on the heart and in turn puts stress on the valve, which causes the valve not to operate properly, and again you end up with heart valve disease. Another thing, in terms of heart disease, you can have aortic dissection, which that basically means your aorta is tearing. The aorta is the largest vessel in the heart, so the largest vessel in the body, and it can tear, and that tear can extend down to the valve and include the valve, which obviously would lead to the valve not functioning properly, which was, that's what heart valve disease is. The next area that I want to talk about, family history. If you have a family history of heart valve disease, you may have heart valve disease, so it's very important to know your family medical history. Then a couple other things, radiation to the chest. Again, that can lead to stiff valves from damage from the radiation treatments, or certain types of chemo can cause heart valve damage. Chronic kidney disease can cause heart valve damage. Lupus can cause it, and also Marfan syndrome and other certain types of connective tissue disorders. I want to lead into symptoms now. Overall, the damage of the heart valves, because like I said, it's either an issue with the opening or issue with the closing, which both, no matter what, affect the flow of the blood. The symptoms that you get with heart valve disease are related to the ineffectiveness of the blood flowing through the heart in the circulation that it's supposed to. And I'm doing a circle just to make it simple, but I'm talking about the pathway that the blood flows through the heart. So with the symptoms, there is an acronym called LISTEN that can help you remember the symptoms. L is for lightheaded, I is for irregular heartbeat, S is for shortness of breath, T is for tiredness, E is for edema, and N is for not feeling like yourself, because you're basically missing out on your daily activities because you are not basically perfusing your organs well, and your heart is working overtime because it's having to get the blood around, which you're either not feeling enough, or you're restricting the flow forward, or you're leaking the flow backward, and you're not passing enough blood through. Therefore your heart is struggling, pumping, trying to get as much blood flow to your body. So of course you're going to be tired. Why? Because your heart is tired. Of course you're going to feel lightheaded because you don't have enough blood going to your brain. Of course you're going to have edema because you're having backing up or congestion of the blood that's causing swelling in your legs, swelling in your feet, things like that. You're going to be tired, again, not enough blood flow to your organs. So, and you're going to be short of breath. Again, you're not getting the blood to your lungs to oxygenate, to get oxygen for the rest of your body. So LISTEN, that's an acronym that you can remember. Lightheadedness, irregular heartbeat, shortness of breath, tiredness, edema, which is swelling, and not feeling like yourself. So I know you want to know, can this be prevented? Obviously, you can't change your family history, right? So that part, you can't really do much about that. The other thing, congenital. You can't change how you were born in terms of the actual structure of your heart. You can have treatments, obviously, for heart valve disease, but I'm just saying in terms of risk factor, you can't change your family, and you can't change your how your heart was made at birth, right? But the other things that you can prevent, again, I know I'm going to sound like a broken record, but you can prevent certain things like high blood pressure, which I talked about in the risk factors portion. You can prevent high blood pressure or manage high blood pressure to where you're not having uncontrolled blood pressures, which means your heart isn't having to work harder to work against the pressures in your vessels. That's one thing you can do. And you know, diet and exercise. Again, I sound like a broken record. Diet and exercise. Eat healthy, be active. That is a really important thing that you can do in order to prevent heart valve disease. I hope that you enjoyed the information in this video in terms of learning more about what heart valve disease means, what risk factors there are, what symptoms to look out for if you are having these, and how it can be prevented. If you are having any of these symptoms that I talked about in the video, or you have a lot of risk factors or a lot of family history, please see your primary care physician. Obviously, if it's some type of emergency where you can't breathe, or you know, you're having rapid heartbeat, or you're feeling fainty, passing out, call 911 and go to the ER. But I'm hoping that this video did pass along some very important information for you or your friends, your family, anybody, so that you can gain something from this video. If you did like it, please like it, subscribe to my channel, share this video with a friend or family member. If you have comments or questions, you can leave that in the comment section. If you want to recommend a Wonderful Wednesday video for future Wonderful Wednesdays, you can leave that in the comment section below. But again, as always, thank you for sharing this Wonderful Wednesday with me. Be blessed and stay healthy.